All right, we're back for another episode of The Climb, and we have a new friend of the program, Madeline Mayhew. She has been all over the place when it comes to being a mental health advocate, and super excited to have her on. So I'm going to give you a head right there.
Thank you.
Thanks for
Thank
coming
you.
on. And do you want to introduce yourself? I know you have a laundry list of experience already at your young age, but it's quite impressive, and I'm so excited to introduce you to our audience here.
Thank you so much. That means a lot. So I graduated recently with my bachelor's in psychology from Georgian Court. I just recently started my graduate program here as well. I came back to my alma mater. We're a KCREP accredited program for clinical mental health counseling. And I have the intent of going back for my PsyD in clinical psychology. And I have like a decent amount of experience considering that I'm like
Oh,
pretty
you're being honest.
old.
Decent is not the word. You have the experience, a lot of it. So, go ahead. I'm sorry to cut you off. I just wanted everyone to know that you're lying.
So I have done like some like research in the field. Like prejudice is like a really important topic to me. Um, I worked hand in hand with a professor here. She's actually the chair director, so shout out to Dr. Susan Field. She's great. She's helped me so much on my journey, along with a lot of the other professors I've met here. They really want to see us do well, and I feel like I've really blossomed because of them. So I just want to thank them.
Mm, that's
Um,
awesome.
Thank you. And so one of the like, research studies I've done was about prejudice. Specifically with non-binary and transgender individuals and using the restrooms and like single user all gender restrooms, and since then we have added at least one single user all gender restroom to each building on our campus.
Oh, wow, that's awesome.
Yeah,
Very,
and
very progressive with the study and then already coming out with something. That's
yeah,
awesome.
yeah, I did that my undergrad, and I presented my research at our school's academic excellence night. It was a group of me and three ladies, and we won third place. So I thought that was pretty cool.
That is awesome.
Um, and then I went on to continue that study, and NASA picked it up, and they were interested in it in terms of human exploration in like space shuttles, because we have to have like all the astronauts have to be comfortable with each other so that they can complete mission tasks. And so they picked it up, and they gave me a research grant, and I presented at a NASA conference. I presented it at the APS, which is Association of Psychological Sciences conference in Washington, D.C. I've done a couple internships. I interned at a mental health and substance abuse clinic as
Mm.
relevance behavioral health in Freehold, New Jersey. And I was a summer intern at Integrative DBT and Psychotherapy, which is based out of Philadelphia. But Dr. Dusing also has a satellite office in New Jersey. He's licensed in a lot of states, and I'll actually be working under him as a pre-master's level therapist, which is like pretty uncommon. But he set him up for it, so I'll be starting
Mm.
that soon. I have EMDR training. It goes on. I've done a behavior assistant. I've done direct support professional. I've worked with people of all ages with mental health, substance abuse, intellectual developmental disabilities. Yeah, like I
Yeah,
mentioned.
so it sounds like, do you have time to sleep? Sleep's pretty important to a mental health, you know? It sounds like you got a lot going on.
Yeah,
Hopefully, you're still sleeping at night.
I think one of my favorite things I've done is the peer mentor and transition career studies program here, and
Mm.
I was a peer mentor and compliance director for the program. So it's our school has this really cool thing where individuals, like college age students, can get college experience and learn like vocational skills. And so like I taught classes, like mealtime assistance, tutored, proctor, exams. I supervised practicum experiences. Yeah, I'm kind of all over.
So we're what, 4 minutes and 30 seconds in, and if you don't believe that Madeline has the credentials to speak to our audience, you're just listening to the wrong video. So that's awesome. That's incredible. And One thing I wanted you to really share with the audience is your experience working with and knowledge around those warm hotlines. And I know you have great experience there. And as we were talking before the podcast, it is such a huge resource that I don't really think people take advantage of. And if you could tell us a little bit more what they are, your experience, what they do, and maybe how someone can utilize it in the future.
Absolutely. So I volunteer with the Crisis Text Line. It's at crisistextline.org. It's free 24/7, and you get connected with a trained crisis counselor like me and countless others. Um, and it's available to anyone anywhere in the US. They do have similar ones. Like in the US, you can text 741
Mm-hmm.
or 988, which they just came out with recently. Don't quote me, but I think within the last 2 years they've come out with it. And it's like they have like 911. 988 is like easier for people to remember, so you can text, call. Also, you can use WhatsApp to get this help.
It's awesome.
Canada's number is 686-868. The UK is 85258, and Ireland is 50808. So those are just like a few
Mm-hmm.
numbers that people can reach out to. It's a secure online platform. Like if you reach out, your information is completely confidential.
Mm-hmm.
You can share as much or as little as you want, what you feel comfortable sharing. I think it's such an important resource, and I feel like a lot of people don't talk about it because I know that mental health, especially like here in the States, is like overlooked, and it's like people have issues with like affordability. But this is like completely free, and you can use
Mm-hmm.
it whenever, as many times as you need. Um, and the
So
goal,
with oh, I'm sorry to interrupt you.
uh,
So with the hotline and the text lines, let's role play here because this has happened to me prior to being hospitalized. I have no idea where to go. I think something's wrong with me. But every time I was hospitalized, I'm learning more and more about the mania that I have, and unfortunately, it always becomes too late to get that help. So let's just say that I'm feeling like I'm hovering and I'm all over the place. I'm not losing tons of sleep, but I could sleep a lot better. Like, should I be reaching out to you if I'm, questioning it, or should I be waiting?
no, you should reach out. Whenever you feel the need to, and we're not here for like your life's like an imminent danger. Like we cover like a variety of categories, even if you just need someone to talk to. We help with people with gun violence, anxiety, eating disorders, depression, suicide, self-harm, bullying, immigration
Wow.
issues, women's issues, like you name it. Like this is like we're here for. We're trained to do it. And so it's brought up by volunteers. Volunteers have to go, like they get vetted to volunteer. Pretty much anyone can do it if they want to. You do have to go through an extensive multi-stage application process and background check, and then you have to do a 30-hour training program. It takes roughly 30 hours. And they only ask that you volunteer minimum 4 hours a week until you hit 200 hours, which should take you like about a year, because they do have to like pay for your training.
Sure.
The training is free to us, but like, that money has to come from somewhere. So they just really ask that you really commit to the program if you were to volunteer. But it's free for anyone to use. You don't have to pay to reach out to us. Again, text or call 988. Um, most online, most phone carriers don't charge for it. I know
Mm-hmm.
AT&T, T-Mobile, Sprint, and Verizon don't charge. And if you're like a minor, or if you're sharing a phone bill with anyone else, you don't have to worry about it coming up on your phone bill. It will not show up.
Mm-hmm.
Um, Other carriers, if you don't have AT&T, T-Mobile, Sprint, or Verizon, I'm not sure. But I do know that they will just show up as 741-741. It's like our short code, but it won't have any information about this is a crisis text line.
Sure.
So if you're worried about like your parents looking at your phone bill, like they'll have no idea. It's completely confidential. It would just be you talking with an anonymous. crisis counselor. If you have
So
a
what you're telling me is that one, everyone is completely credentialed,
yes,
more than probably they need to be for other hotlines or other things of that nature on the internet. Um,
yeah,
Completely credentialed. It is very simple and easy. It's a resource that's out there, and I think the most important thing, it's confidential. I mean, if you don't want to have that conversation, I mean, we at Team Garbo really emphasize the aspect of community and leaning on people and deepening your roots. But sometimes it takes a little bit to get there. And maybe that this is it, going to, a hotline of this nature, text line, warm line. And that's awesome. It's a very resourceful thing. So I guess because we're gonna have to have you on more because you have so much to share and it's such great experience. If if you're kind of doing a PSA for everyone out there, and it's not just mental health or tributaries of mental health, emotional health, and behavioral, you name it, you guys, that hotline can help out so many people. If you had a 30 to 60-second spiel on, hey, check this out, what would you be saying to that person who was probably like in my shoes a couple years back?
I would say that you're not alone. There's so many people out there that care about you and they want to see you do better, and like we are here to help you. This is not a long-term solution. We don't replace the role that like a counselor would have, because they're like the crisis counselors are not trained medical professionals, but we're here to listen to you, and our goal is to help you move from like a hot spot to a cool spot. Whatever situation that you might be dealing with, we're here to help you just like feel better about things, and we can outsource you to other professionals, help you find the tools that you need to get the help that you need. And I think it's just like such an important thing that isn't talked about enough. Um, so I don't know, I think it's really important. It's a secure online platform. It's privately funded by like individuals and foundations, but I feel like it should definitely be talked about more often. If you want to donate, donations are tax deductible. So if you're looking to help with a platform, you can donate. You can share the number with anyone that you think that might need it, or you can volunteer. There's a lot of different ways that you can help. And if you're not experiencing crisis, but you feel like you're worried about someone in your life, a loved one, and you don't know how to approach them or help them, you can text us also, and we'll give advice. We have English and Spanish trained crisis counselors. We're working on getting more crisis counselors that speak other languages. But right now we're just English and Spanish, and you can call or text 988 for help.
Well, that's awesome. I'm gonna have to get all your that information, put it on Team Garbo's resource page because it really, honestly, just hearing you talk about it makes me feel warm and fuzzy that we have really great people in this world, and you're one of them. So thank you for all the work that you do, and honestly, like spreading the good word. There should be more people like you in this world, and honestly, I think you're doing a lot of really good work, and you're just starting your career. So excited to see you blossom. Also excited to see you hopefully back on here again, share more experiences, maybe help break down the stigma with us and be that bridge from the everyday person to the, mental health professionals. So
Thank you so much. I really appreciate that.
awesome. Well, Maddie, we'll look forward to having you on again, and to everyone else, thanks for joining in.